I'm excited to have us back in person for our Thursday IRP seminars, and we're thrilled to have Courtnee Melton-Fant with us. She is assistant professor at the University of Memphis and will be talking to us about her work on the production of economic and health inequality. I forgot to ask, would you like questions as you go, or we can have, or hold to the end?
At the end, I guess if something's like burning,
Yeah,
you
if you're
can pop. If
completely
you just
confused
cannot,
and have a
yeah.
burning clarification question, she will take it, but otherwise we'll hold the substantive discussion until the end.
Okay.
Thank you very much. Take
All
it
right,
away.
thank you. All right, so I'm really happy to be with y'all today and to share some of my work related to preemption. I'm going to talk about two projects that I've kind of already completed and then share some preliminary stuff kind of based on my previous work in this area. Okay, we don't want to click. I just want to disclose that some of this work was supported by a grant from the Russell Sage Foundation and the National League of Cities. These are my views, not theirs. Yeah, you can. So I want to place kind of what I'm presenting today kind of in the context of my larger research. So I'm trained as a health services researcher. I've clearly taken a departure from that. And so I kind of think of my work in these three big buckets. And then sometimes I'm in two buckets and sometimes I'm in three. My preemption work is kind of intersects at all three of these. So before, thank you. We can really talk about what preemption is, we need to kind of set the level with kind of the basic structure of how our government works. So we are a federalist structure. That just means we have a national government and subnational governments, which are our states. And so they have a relationship. It's a dynamic relationship, right? So the relationship between the states and the federal government today is not what it was 50 years ago. It's not what it was when the country was originally founded. In federalism, it responds to kind of the different social and economic and kind of cultural factors happening in society. So we have these governments, but that isn't all. So we also have local governments, right? So we have federal, state, local, and they're all making policy, sometimes on same issues, sometimes on different issues, and sometimes they intersect, sometimes they don't. And the Constitution lays out kind of the original relationship between federal and state government. So we have kind of the supremacy clause. The most important thing is that the federal law is the supreme law of the land. We also have something that we talk about delegation. So the 10th Amendment is saying the powers not delegated to the federal government by the Constitution are reserved to the states. So the Constitution, federal and state governments, they're there, their roles are defined. But what about local governments, right? They're not there. So they're not in the Constitution at all. And so local authority comes from state constitutions. And so the relationship between, the localities in Wisconsin is going to be different than what it is in Tennessee, and that's lined out in the state constitution. Sometimes the Constitution will even tell a locality these are the services that you have to cover. And so it's very different, but they're not in the Constitution. So that's kind of where preemption comes in. So we have these three kind of different levels of government, but there is a hierarchy. So preemption is simply when a higher level of government, it limits or eliminates the power of a lower level of government to regulate on a specific issue. So it's just a legal doctrine. And there's kind of different types. So floor preemption is when we're setting a minimum standard. So the example of a floor is the federal minimum wage, $7.25. 25 cents. If the states want to say we want to raise our minimum wage to $10 or something, they're free to do that. Ceiling preemption, on the other hand, is kind of working in the other direction, and so it's prohibiting or limiting the authority of a lower level of government to do something. Historically, it's been used to really resolve conflicts. So sometimes all levels of government are regulating on an issue, and sometimes a state passes a law and they're trying to interpret what does that mean in light of the federal law. And so it's been used to resolve things. And then also historically, the federal government has come in and preempted discriminatory state and local policies. So our big Civil Rights Act is a preemptive law preempting state-sanctioned discrimination through Jim Crow. And so preemption is just a thing. But there's been a departure from that historical use. And so now Richard Briffault was the one who kind of coined this new preemption. But instead of these historical uses, he says that states are clearly, intentionally, extensively, and sometimes punitively barring local efforts to address a host of local problems. So what does that look like? I have two examples. One is from here. So both Madison and Wisconsin and the city of Birmingham, they both felt like they needed to raise their minimum wage. And so they went through the proper channels, passed a local law, and the state came in and said, no, y'all aren't doing that. In the case of Alabama, they preempted it 2 days after the city passed it. So you can see this is not about resolving conflicting laws. This is not about intervening because of discrimination or unjust things. This is a different kind of flavor of how their states are behaving with localities. And so new preemption, and throughout this presentation, from now when I'm referring to preemption, I'm really talking about the ceiling, not the floor. So this new preemption has increased a lot since 2010, and that has coincided with in around 2010, 2011, we saw a lot of Republican governors coming into office and having Republican majorities in state legislatures. And it's also been promoted by more conservative interest groups, primarily the American Legislative Exchange Council, also known as ALEC. And so ALEC is an interest group, and it's majority conservative legislators. There are some other legislators in there, and a lot of business groups and corporate groups. And so they have really used preemption as a strategy to promote this kind of deregulation for businesses, making state laws more corporate friendly, and really kind of concentrate power in state houses, because that is ALEC's primary target, is working with state legislators. New preemption is also different. It's because it's getting into very broad policy areas, so local labor policy, public health, environmental law, a lot of things. And it's also different because they're doing something we call preemption plus. And so they're adding preempting localities and then offering punishment. So for example, they'll say, we're gonna preempt this, and if you do violate this law, they've threatened to sue local legislators over it. They've also threatened punitive damages. So if you violate this preemption law, then we will withhold your share of sales taxes to your city or county. And so they're preempting them and then also punishing and kind of adding a threatening portion for them kind of not falling in line with the law. And so because preemption is just a kind of legal doctrine and a policy tool, and historically it was used one way and now it's being used differently, it's important that we use an equity lens when we're kind of talking about what the effects are or why it matters. The equity lens is we're gonna ask three questions. So what are the goals and values of the underlying policy? Is this policy helping or hindering inequities? And then because policy is not passed or enacted in a vacuum, how is this policy intersecting with existing structures and power dynamics that we have already? And so I have argued that new preemption is actually being used as a tool of structural racism. And I say that because it's consistent with Bonilla Silva's characterization of colorblind racism. And so one of the tenets of colorblind racism is that it's enacted through this idea of states' rights, states' intervention, and preemption is absolutely enacting a political agenda through state intervention. The second tenet is that colorblind racism is invisible. So old style racism, Jim Crow racism was very in your face. So your drinking fountain's over here, y'all's drinking fountain's over here. We're not doing that anymore. And so it's something much more invisible, and it's easy to miss if you don't know what it looks like or you're looking at it. In preemption, particularly, they're using very covert tactics to pass and justify these policies. And the last thing is that it uses this race-neutral terminology. And so previously we used very explicit racialized language, and now we don't. And so race-neutral it's race-neutral in practice, but it's not considering the existing racialized structures we have, or looking at what race means historically as about power and social dynamics. And preemption does the same thing. So first, to the point of state intervention. So this is a quote from ALEC, and ALEC is saying, Unfortunately, local governments, they've become victims of far-left organizations and manipulating public and local officials to create policies that hurt economic development and individual freedom. So again, they're framing this as local governments, they're victims and they're being manipulated. So they're not passing policies because those are their policy preferences or that they're necessarily reflecting local needs, but that they've kind of been hoodwinked. And so it's important for the state to intervene because things aren't going correctly. ALEC primarily works with state legislatures, where they have kind of a smaller group called the American City County Exchange that focuses just on cities and counties. And John Russell is the head, and he correctly points out that cities and counties, they're not in the US Constitution. Then he says, we have created you for a specific purpose, and you guys are overstepping what we created you to do. So again, this idea of the state has to intervene because these localities are overstepping their bounds and they need to be put back in their place and do what we created them to do. And so what this has done is it's really tipped the scales, right? So the state legislature, what they think, whatever their ideology is, that's completely overtaking local needs and policy preferences. So states at the same, they're describing localities at the same time. That one hand, they're victims, but then they're also overstepping their bounds, which is kind of contradictory. And so what this has done is created policy vacuums. So local government passes an issue, passes an ordinance, the state government says, no, you can't do that, but they're not offering an alternative. And so then nothing happens. So we call that a vacuum, where there's just kind of policy nothingness. And it also has really consolidated power at the state level. And so local governments have problems. They have kind of fewer tools in the toolbox to address them. And so they have to go to the state legislature to get their local problems addressed. And then the state legislature has all the power because they can choose to either address the issue or they address the issue in a way that they deem appropriate, kind of based on their perspective. It's also just extremely reactive to local policymaking. And so localities are doing things and then the state is reacting. So they're not addressing these issues on their own and offering something, but just reacting to what they're doing at the local level. As for the invisibility, preemption kind of flies under the radar because they use very specific tactics to pass them. So one is they just quickly pass the bill. So sometimes the bill could be introduced on Tuesday and then it's passing and going to be sent to the governor's desk on Thursday or Friday. And so that doesn't leave a lot of time. They're also adding them to unrelated bills. So a bill could be about one topic and then they just throw in some preemption, or they do a little amendment that's preemption of something completely unrelated. They're also bundling them, so just preempting a lot of things within one single bill. And the last thing they do is they use very obscure titles. And so if you looked at the title, there'd be no way for you to know what was in the bill. So these are all examples of titles of preemptive bills. So sometimes it's like equal access to interstate commerce, freedom in contracting. Then you have this weird one at the bottom about regulate dog sales and license pet stores. And so that was actually Ohio's pet land bill. And so it was about that, but they also preempted paid leave within that bill. And so unless you know what you're looking for, there's no way that you wouldn't know that. You wouldn't think, oh, paid leave in the dog sale bill. But these are kind of tactics that they're using to pass these. And an example of bundling, North Carolina, their big bathroom bill that they passed. But the main piece of the bill is they're requiring these single-sex occupancy bathrooms. But they also, within this bill, preempted local minimum wage ordinances and local regulation of paid leave and employee benefits. And so while all of the attention was going to kind of the bathroom aspect, they kind of snuck these other things in. And so preemption, like I said, it's very invisible. The last piece is that cities are more racially diverse than their state legislatures, often than other parts of the state, and this is even increasing. And so you often have this dynamic of majority white legislatures legislating things at the local level that are responsive to the racial diversity and kind of the needs. And we have these kind of increasing movements towards, racial equity and changing our policies to be more equitable. And the state legislatures are responding to that. Also, in this kind of use of coded language, these things are often dismissed as urban problems or urban issues. In kind of our larger discourse, when people say rural, they are talking about white people, even though all types of people live in rural areas. And then urban is often coded as people of color. And so they're invoking this kind of coded language that's picking up on how we use language in our society, and they're just using that. And so when they use these things, they don't have to use explicit racial terminology. And then also they're just kind of, these bills, they're building on these existing systems, racialized structures and systems that we have. And so some solutions are being offered, and then preemption is happening, and it's just kind of mixing in this system that we have. And so kind of the three big effects of this is, one is we have this kind of chilling of local policy. And so what local legislators are doing, sometimes they're not doing anything because they're scared about, no one wants to lose sales tax revenue or be prosecuted for, implementing a law. Sometimes they're just unsure about what they're actually able to do in light of the state preemption. And then sometimes they just don't do anything. I've heard local legislators in my city, there was some issue and they're like, well, we're just gonna wait to see if the state preempts it first before we do anything. So that's what we call a chilling effect. So things aren't happening, and a lot of things, sometimes the city will implement something and it works well and other cities might pick it up. And so all of that chilling is chilling kind of local policy innovation. It's also very difficult for community organizing and advocacy. So if these things are happening quickly or if it's invisible, it doesn't leave time to do advocacy work on these bills, to even educate legislators about the potential effects. If you bring it up on Tuesday and you pass it on Friday, there's no time for meetings or discussing things. And then also, I argue that it can creating or exacerbating existing inequities. And so a lot of the preemption research, because it's legal doctrine, it's very much looking at the causes and the politics around why preemption is happening, why they're doing this, and we know a little less about what are the actual effects in the larger population and then kind of differential effects within a population. And so I started, this first study I'm going to present is kind of my attempt to kind of start using this equity lens and kind of look at if there are some differential effects of preemption. So a little background. So we have, I think everyone knows, we have a housing affordability crisis even before COVID, and particularly people that rent and people of color were disproportionately affected. Lack of access to affordable housing, we know it causes financial distress. A host is associated with poor mental and physical health outcomes, and also less money for other essential needs, right? So you want to keep a roof over your head. If the majority of your money is going to rent, that means less money for food and transportation and healthcare and kind of other needs. So one tool that local governments use to try to increase the supply of affordable housing is inclusionary zoning. And so inclusionary zoning is tied to the development of new kind of rental rates. So on your right, let's say I'm a developer, I come in, I'm building 10 units, I sell them all at market rate. If I'm a developer and I go in and they have an inclusionary zoning requirement, I build the 10, but 10% of them have to be below market affordable units. And so in addition to increasing the supply of affordable housing, inclusionary zoning is supposed to help create mixed income communities, because we know we live in very economically segregated. Whereas if I have a multifamily building and I have actually a mix of people with different incomes actually living together. It's also supposed to help create access to kind of these high opportunity neighborhoods for people with low incomes. It's best if it's mandatory. So you can imagine a developer, I'm not going to come in out of the goodness of my heart and offer some of these below market rate, because that's messing with my bottom line. So I'm not going to do that. So it needs to be mandatory for the development of the units. And the last thing that it's supposed to do is we have kind of land use and planning has this history of very exclusionary zoning policies that created and entrenched racial and economic segregation. So inclusionary zoning is supposed to kind of start chipping away at that. So in addition to creating this affordable housing, it's supposed to do kind of all these other things around equity. But some states do preempt this. So in the dark blue are the states that preempt inclusionary zoning, and the light blue states that don't. Most states do not. There's not a super clear pattern. It's not like it's only happening in this one region. And this is accurate as of August 1st, 2019, when I did this work. And so I don't think anything's changed, but it's possible. So if it did, I warned you. So I had kind of two big questions that I was interested in because of the links between affordable housing and health. Is there a relationship between the preemption of these policies and health outcomes? And then two, if there is it going to vary by race and ethnicity? Because I'm assuming that some groups would disproportionately benefit from inclusionary zoning, and so I would think the taking away of that option would be disproportionately harmful to them. So the preemption data came from Temple University. They have their policy surveillance program, and basically they take language from laws and turn them into zeros and ones for quantitative use, and they cover a broad range of areas. And so I used one coding question, just asking, does the state law preempt local mandatory inclusionary zoning for residential units? And it was just yes or no. The health outcomes came from the behavioral risk factor surveillance system, and I was interested in two things. So one, are they delaying medical care due to cost? And then two, just looking at a general self-rated health status, so looking at poor or fair self-rated health status. Some of the other variables I included at the state level, I tried to get at kind of things that might affect their housing market. So because inclusionary zoning is tied to the development of new housing units, if you're not building new housing units, then inclusionary zoning isn't an issue, right? And then also looking at population growth, because that puts pressure on the housing market. At the individual level, just kind of health insurance, home ownership status, income, tobacco use, so things that are related to both health and people's housing situations. So I did basic multivariate logistic regression. I clustered the standard errors by state because the individuals are nested within states. I also excluded adults that lived outside of metropolitan areas. So inclusionary zoning is really not used in rural areas, so I wouldn't think this policy really had was consequential for those individuals. I also ran separate models by race and ethnicity. One, I'm expecting there to be differences. There's no reason I don't want to control for race. That's my interest. And also there's no expectation that this policy would be doing the same thing across these racial groups. And then for the significant variables in the regression, I did some post-estimation, I did marginal effects. So the takeaway, I'm just presenting some of the stuff from the tables, but one is that states that preempted inclusionary zoning, they were different than states that didn't, kind of from the get-go. So in the states that preempted, they had a higher proportion of adults reporting already that they were delaying medical care due to cost, that they had poor self-rated health. They also had kind of higher proportion of Hispanic populations. At the state level, the states that preempted had lower per capita GDP, so maybe those states have differing kind of fiscal capacities, and then lower per capita income. And so the two main findings, one is that preemption was associated with the higher likelihood of having poor health status in the overall population, Black adults, white adults, but not Hispanic adults. And then as far as delaying medical care due to cost, preemption was associated with the greater likelihood of delaying care due to cost, but only among Black adults. And I have no idea why all the results, nothing was significant for the Hispanic population. So if anyone has any ideas, I'm open to hearing them. And so then these are just the predicted probabilities. So in the dark blue for delaying medical care due to cost among Black adults, in the dark blue, it's the preemption states, light blue, no preemption. So not a huge difference, but significant. And this is looking at self-rated health status. Again, dark blue is in preemption states, light blue, no preemption. And so for each group, you can just see a higher proportion of people reporting this than states where they didn't preempt inclusionary zoning. So the findings, they're consistent with the previous literature that's linking housing affordability and health. So that's not surprising. Also, kind of the racialized effects of public policies. We often evaluate the effect of policies on the total population, but they often have differential effects across groups. And then lastly, this study kind of started me thinking of preemption, not just about the bill, but as a marker of some kind of larger political context that might be important for health or other outcomes. No study is perfect. A big limitation with this one, this is just an association. I can't tell you that preempting inclusionary zoning causes poor health. Like, that's not true. I wouldn't say that. It was also cross-sectional, so this is just a single point in time. I have no idea about the trends over time. And then a big one too is that no local government is only using inclusionary zoning as their only strategy for affordable housing. So it's usually part of some kind of larger strategy, and my study just didn't capture that at all. And so I used kind of what I learned from that study, and then also this idea of new preemption in the structural racism context to inform this project that I'm working on now about workers' rights preemption policies in the US South. So I want to let y'all know when I'm talking about workers' rights policies, what am I talking about? So one, minimum wage and paid leave. I think we all know what those are. Project labor agreements are when there are municipal contracts for construction and groups are negotiating with the government for better pay, safety, employment benefits, that type of thing. Prevailing wage is kind of similar to the contract. So it's when there's a contract, let's say I'm hiring a bunch of people to work on roads. The prevailing wage is saying that you have to pay them at least the median for this living area. So if I'm doing, so it's adjusted to, so you can't be lowballing people, but it's kind of setting a pay rate. And the last one is this idea of fair scheduling. And so a lot of people that work low wage work, particularly in retail and restaurants, their schedules are not predictable at all. So they have no idea how many hours they're working per week. Sometimes they find out their schedule the day before. Sometimes they find out 2 hours before and they need to be in. And then if they don't come in, they're penalized. And so these are laws saying you have to give people fair notice. Their schedule has to be in advance. If you do call them in, then you need to pay them an additional wage to compensate them. And so these are all really aimed at mostly kind of low wage workers, but really about giving people good conditions for working and fair pay and predictable schedules so they can kind of have all the benefits that other workers have and kind of higher wage white collar workers. And so this project came about because a lot of states have preempted things or passing bills or attempting to preempt workers' rights. And I'm thinking that it's really creating a policy context that is kind of adversarial to people's economic outcomes. And I think that kind of based on who does this type of work, that I would expect this policy context, the effects, to really vary by race and gender groups. One, because of existing structural racism. Two, we have occupational segregation. So low wage workers are disproportionately women of color, Black and brown women. And a lot of these policies, the calls from them have come from kind of organizing because these workers would disproportionately, they would benefit the most from these. So me, I'm a professor, already have paid leave, whether they preempted or not, it doesn't affect me at all. And so these policies are beneficial for already marginalized workers. Also, workers' rights, they're very emblematic of new preemption. So this is an area where local governments have really taken the lead, and we've had federal and state kind of stalemate, right? So we don't have a national paid leave in this country. Our minimum wage is still $7.25, and so local governments have been stepping up to the plate. And again, the calls for these are really about promoting racial and economic justice and reducing inequality, and states are preempting and responding to those explicit calls for equity. And so why the South? It's not just because I'm a Southerner and I'm biased, but it's because the South, they have a unique kind of shared political history and culture, and often studies that are nationwide, if there are differences in the South, sometimes they're reduced to, well, the South is different and kind of has this. And so I wanted to kind of take that out of the equation. Also, even though the South is this place, it has significant variation within it. We also just preempt workers' rights more than any other part of the US. The Midwest is second, so not too far behind, but the South kind of takes the lead on this. And then lastly, this was really important to me because when I'm taking on this work, I already have an idea of how I want it to be used. And so before, when I was working around the state legislature, they were very dismissive of evidence that came from other parts of the country. And so if you showed them a policy or a program, it was, well, we're Tennessee, they don't understand our culture here, they don't understand our values. And so I wanted to help create an evidence base around this that they would actually listen to. And so if they're going to dismiss the work, it's not going to be because it came from somewhere else. They can dismiss it for another reason, but I wanted it to be used in this context where I know this work is happening, and where community organizers and even people kind of on the legal side is like, we need evidence of the effects of these policies to kind of rally people around it. And so that's what I wanted my work to be used for. So just to give kind of a snapshot of where we're at with low-wage work, the majority of the South, with a few exceptions, is still operating under $7.25. You notice Georgia is special. Their state minimum wage is actually $5.15, but because of preemption, they have to operate under the federal level. There's also 5 states with the asterisk, so Louisiana, Mississippi, Alabama, Tennessee, and South Carolina. They actually have no state minimum wage, so if this wouldn't happen, well, I don't know, this wouldn't happen, but if the federal minimum wage magically went away, you could pay workers kind of whatever you wanted to because we don't have a state minimum wage. And so this is not an ideal situation for low-wage workers in these states. And so I had kind of 2 questions. So one, I wanted to know, how often are these bills kind of coming up and being proposed over time? And then what is the relationship between this kind of state labor policy context that they're creating and individual economic outcomes over time as well, and then across race and gender? And so these are kind of the 4 areas where I'm trying to build off of my old work and kind of improve it. And so one is longitudinal. So I'm picking up starting in 2009, before new preemption takes off, going through 2019. I'm also examining kind of a suite of policies instead of a single policy, because no one is exposed to one single policy at a time. And then particularly with workers' rights, these policies kind of intersect and complement each other. 2, I'm also assessing bills, not just laws, because my kind of theoretical concept is that the bills matter. So the introduction, 1, is signaling some type of difference already between what the state thinks should happen and what the local government thinks should happen. When a bill is introduced, the advocacy groups, community organizers, even the lobbyists for the local government, they're spending time fighting the bills. So they're still having an effect even though they haven't passed. And then they're also they're signaling kind of their intent. And so I'm assessing the bills, not just the laws. And then also taking a more intersectional approach. So last time I only looked at race, but now I'm doing race gender groups and adding more groups. And so I'm just going to focus on kind of the first question about just kind of the distribution and the prevalence of the bills. But for my methods, I use legal epidemiology, which is kind of it's a scientific method for kind of assessing the content of the law and again, turning it into zeros and ones, because the assumption is that law is a predictor I've lost my train of thought, but law is an exposure and a predictor can be of population health outcomes, and so we need to assess it as such. And so I created a database of these workers' rights preemption bills from 2009 to 2019. And then in addition to just kind of taking them, turning them into zeros and ones, also doing kind of a legislative analysis of the bills. So what's the legislative intent? What are the patterns? Are they bundling? How often are they coming up? Kind of what's in them. Then the plan is to do kind of some longitudinal kind of regression once I merge that database with some other data. So these are a total, just in that 10-year time period, there were 134 bills of these that came up just in the South. So you can see in 2009, 2010, not too much. There's a big jump in 2011. I'm thinking that has to do with what was happening with the legislatures having the Republican supermajorities. And so this is their first time they can really try this stuff out. Then it kind of goes away, and then starting 2015 onward, you can see it's just kind of a much more steady flow of these bills. And if we're talking about what types of workers' rights they want to preempt, paid leave and minimum wage are the most popular, and fair scheduling is the least popular. This was really interesting to me. So if we're looking at which states are doing it, there's a lot of variation. And so the biggest offenders are Florida, Tennessee, and West Virginia. So they all had over 20, whereas you look at Virginia has 0. So this isn't part of how Virginia kind of does policy and kind of interacts with their localities. And Maryland had 1. And so there's a lot of variation. So even within the region, there's different kind of contexts and different things that are going on. If you look by issue, so some states are only kind of preempting the darker red. So there's 3 states, West Virginia, Tennessee, and Florida. They have bills in all 5 of kind of these areas. Again, Virginia is 0, but some states are maybe only minimum wage is the only thing they're going after, or there's some, they're just 1 or 2, and then kind of the big offenders are going kind of out the full suite of the policies. And so to get to legislative intent, I wanted to know kind of because again, I want to look at the underlying kind of goals and the values, like what are they talking about why they're doing this. So this is Arkansas. If you notice, Arkansas, their whole legislative intent is very much about, from the perspective of Arkansas employers. So they want Arkansas employers to grow their communities. They want to create a stable environment for Arkansas employers. And they consider these mandates as burdensome and unnecessary. And so this is just language from the bill. Florida's was a little different. So they still brought up this idea of a stable business climate, but then they were one of the only states that talked about we need to balance the needs of workers and the needs of the employers. And they also, had the argument that if you allow localities to do this, and these businesses, they will just leave these cities and they might even leave the whole state because of these mandates. And so we cannot allow this. Alabama, this was a bill about project labor agreements, and they were very much talking about, well, these have become very common. And so it's necessary now that we have to step in and intervene. And so, because they are, again, very concerned that employers are treated in the fairest way possible. So these are very much kind of written, and the expressed intent is about what's important for employers and business, but not thinking about local preferences or even workers or why these bills are even happening in the first place. And so sometimes the legislative intent isn't in the bill at all. So they just write the bill and say what they're doing. But you can find the legislative intent in the media now, which is very easy to find. And so this is from Alabama, and they were talking about why they needed to preempt Birmingham's local minimum wage. And so this is, I assume it's Jabba Wagner, but he was like, we want businesses to expand, and it's important that we create predictability and consistency for the economy, and that's going to benefit everyone. And so he was very supportive of preempting minimum wage. And then on the other end, so it's not always a partisan divide, but we have Linda Coleman Mason, who's a Democrat. She voted against this bill. And she was like, well, someone has to recognize that we have a working poor class of people that are not just in Birmingham. So often, because of the way new preemption is working, that they're targeting cities and being very responsive to cities and acting like these problems are limited just to the cities. And she's saying, no, it's not just Birmingham, but we have working poor class of people all over the state, and the state legislature needs to recognize. Paul Busman brings up something. He was a Republican. He did not support it, but he was like, there may be a time my district needs something that none of y'all understand. Does that mean you'll come in and prevent that? And so again, this idea that there actually are local needs and being responsive, and he's like, this is setting bad precedent. And so sometimes the legislative intent is happening. The legislative intent that's in the bills is very often different than the motivation for why these bills are happening. Birmingham actually sued the state of Alabama over the preemption bill, and it eventually got thrown out. They passed one level of government, but then their Supreme Court didn't allow it to. They said they didn't have the grounds for it. So my initial kind of observations is that in the intent, there's just, again, much more concern for businesses than workers or local preferences. Also that there's very unequal exposure to these kind of restrictive labor policy environments. And so people are working under very different conditions. And I think that matters for their economic well-being. Also, there's a different trend of kind of this one and done versus high volume. So for example, in Tennessee one year, they had 5 different bills all preempting minimum wage. And so just maybe one sentence was different, but it's just a constant kind of onslaught. Whereas in some states, you see the bill come up one time, they preempt a few things, and then it just disappears. There was also some trends that came out is that in some states, people were really trying to pass a lot of preemption repeal bills after these passed kind of every year. And then in some states, it was kind of just no action on the issue. So once they preempted like minimum wage or paid leave, there were no other bills that kind of brought up these issues. And it was like the discussion was over and kind of the door was closed. And so there was just no movement happening. And I think those patterns and kind of the strategies behind that, I think those matter for kind of people's lives and their well-being. And so kind of the next steps is one, like I said, is to combine the legal database that I created to do some quantitative work. And then also I really kind of see the need to start doing more qualitative work in this area because the numbers can't tell me the whys and the hows and why, some state legislators are responding like this. We don't have a good idea of how local policymakers are responding to this. So what are their strategies? Are they just avoiding these topics? Kind of what are they doing? And so I'd like to kind of flesh that out to kind of help kind of build strategy for around this because whether they preempt these things or not, these issues still remain. And then I also see just some challenges of kind of doing this work. And so one with preemption is that you're really measuring the absence of something. And so a lot of policy analysis is based on a law actually passing, being enacted, or being implemented. But with preemption, it's saying, no, they're not allowed to do something. And so getting at this idea of this absence and how do you kind of address that and analyze that. Also, the states that really use new preemption, they're different in a lot of other ways that shape inequality. So, for example, the U.S. South, you're looking at it, most of those states did not expand Medicaid. We talk about some of these different states, they have very different kind of the robustness of social services, kind of different fiscal capacities, how they spend on education. And so I think preemption is kind of interacting with these circumstances, but also these states, they're just different in a lot of ways. Also since COVID, since 2020, kind of the pace and scope of preemption, it's increasing very fast and going into a lot of different kind of areas that they never went in before. And so not just public health, they're even getting into kind of how localities do municipal budgeting, zoning, so things that have been very much local stuff. They're getting into kind of elections and all of that kind of stuff. And the volume is just increasing a lot. And so that makes it difficult to do research, to track the bills, to turn things around kind of in a timely manner for people that want to know, well, what are the effects of this stuff? And it's like, we can't kind of keep up with that. Also, when I think about preemption and looking at it, it's very much about politics and power. And so how can you kind of accurately measure that and kind of grapple with that? And so I think, again, kind of my push towards more qualitative work because of those different dynamics and the way people are adjusting. And there's just a lot we kind of don't know about what people are doing. And this seems to be a trend that's not going to kind of ramp down. And so there kind of needs to be strategy and ways for people to learn from each other about how to address these things because we still have, low-wage workers and people working that are not working in good conditions and don't have kind of the same rights as higher-wage workers. And so how do we address that kind of in these policy environments where it's very difficult and kind of come up with solutions? So that's all. So I think that's all I have. So. Yes.
So interesting. Having gone down a road about trying
Okay.
First is, how are you considering, like, it's fairly low effort for a legislator in a state government to introduce a bill, you know?
It is.
And like, so I'm wondering if you're thinking of a way of quantifying how close to law a bill gets.
Yeah.
In terms of your predictors.
Mm-hmm.
And the other question I had, that is, I lost my train of thought.
Okay.
Somebody pulled my note really quickly there. You know, I'm gonna raise my hand again later for some more questions.
Okay, so
Yeah.
there's a lot of, like, when you're doing kind of in the legal epidemiology methods, you can get as detailed as you want. And so you can, track, how far it made it, like, did it die in committee, or kind of the length of time. You can track, if you're actually tracking actual laws, you can do kind of amendments and changes. And so it's all kind of there in the methods, and there's, so Temple created a way, like, it's called Monocle, but it's like the way that you kind of build out your database. So you can put coding questions, and then you can actually link it. It allows you to have the coding questions and the data, and then also the actual language of the bills. And so so all of that is together in one central place. And so that's what I've been using. So you can get as detailed as you would like. It just depends on how much time you have, and then what are you interested in, because sometimes two people are interested in, like, the features of a bill, because two places can have a bill on the same thing, but the features of it are different. And so it just depends on the question that you're asking, but it's possible, yes.
And have you considered how to integrate that into your
I did, and I was like, I'm just gonna start with the introduction and see. And I also just didn't, because most people track laws, not bills. And so I didn't even have a good idea of, like, I had no idea how many bills were gonna end up in this database, or kind of what I was getting into. But I have them, and so I think I will kind of go back, because I was also interested in who was proposing them, and is it the same people, and kind of all of those features. And so I'm kind of thinking of this as laying the groundwork, and then kind of do more detail as I go. Yeah.
I might have missed this, since you were, obviously what you're talking about is building on prior work that you've done, but how did you select your time period of 2009 to 2019? Was there something specific about that?
Yeah, so new preemption didn't really start till 2010.
Oh, okay.
So if you were trying to search for this type of behavior in bills before, then you wouldn't find any. And so 2019, I think I submitted this, like, before COVID. And so I just kind of I wouldn't have predicted that this was going to happen in the onslaught and to keep going. Also, because preemption's become more popular, not more popular, but more kind of well known, is that there are groups now that are tracking bills, but they just started in 2020. And so we didn't know what was happening before, unless you, like, worked in a specific state or something like that. And so it'll be much easier to add on moving forward than to go backwards.
With the first paper on the inclusionary zoning and the health outcomes, I had two questions, and maybe they were up there and I missed them because I need glasses.
It's okay.
So one was just wondering about how the states that had their inclusionary zoning preemption, how that overlays on top of who has accepted Medicaid expansion, and how that might affect kind of people's health
Yeah.
health outcomes that you were looking at. And then the second, in terms of not seeing effects for Hispanic people, I was wondering if you had control for whether or not someone was a first or second plus generation immigrant, because I know we see different health needs
Yeah.
first generation Hispanic immigrants versus others.
So that question was not in the data set. So they don't ask, and they don't even differentiate. I mean, Hispanic is like this catch-all category, and so I don't know, what their nationality, ethnicity, or first generation, third, second. So that wasn't available. As far as with the expansion states, I didn't look at that because most states. Let me go. Let me go back to the. So it wasn't. I think most of the states are. Well, Texas, Louisiana, so some were and some weren't. I didn't look at that. I have done another paper kind of looking at just inclusionary housing programs in health, kind of more specific for places that implemented them, but that might, I think that's possible. I just didn't, I didn't look at that. Yeah.
You talked about, I think maybe it was Birmingham that challenged the preemption, and I was wondering what are the possibilities for municipalities to challenge the preemption?
So some is through suing the state, but they'll usually sue. So Birmingham's was unique. They tried to do it under the 14th Amendment, a violation of equal treatment under the law, because Birmingham is majority black. And so they said this was a racial discrimination issue. And those are I talked to legal people and they said that's just a hard argument to make because of what the courts require for proving something is actual racial discrimination. And so it didn't hold up under that. Some cities have sued sometimes under really specific, like the way the policy was. So some states, they're not allowed to bundle. And each bill has to be its own kind of substantive thing. And so if they bundled, then they sue and it gets kind of thrown out because it was a procedural mistake. Sometimes they sue over kind of home rule violations. So some states are kind of home rule versus Dillon's rule. And that essentially what it is some states, in some localities, a local government, as long as the state says they can't do it, they can do whatever they want. Then other states is like, you're allowed to do this, and if you want to do something different, then you have to get state permission. So some states, some localities were saying you're violating our home rule rights by preempting us on this issue. So sometimes they sue over that. The best way, honestly, is if you can try to prevent it, because they're very hard to overturn. Sometimes localities will pass very narrow laws to try to avoid that happening, or even after it's preempted, they pass something very narrow. And then just kind of the organizing and prevention and kind of trying to stop the bills from passing. And there have been some successes, but it's just with the kind of pace and the scope increasing, it's very difficult to keep like fighting that, and then across all these different policy areas. But there have been some successes.
Is there any flip side to it where it's like positive preemption, like a state in which is proactively taking away rights from localities, but saying, okay, so you have to make sure you're like, is it California with a paid leave and a high state minimum, and sort of like, is that the same thing? If it's
so I wouldn't, because that's why I wouldn't consider it abusive in that way. So I'm very focused on abusive, where you're saying this is the ceiling and we're not doing anything. So I think Virginia did that. So they preempted local paid leave, but it was part of a statewide paid leave bill. And so that's kind of a different flavor than this, but that's not typical. That's kind of not how they're behaving. But that's, I think, one of the not difficult things, but you don't want to like get people riled up and be like, preemption is bad, and then the state does something that you want. And then you can't, and so then how do you organize around that? So being clear that we're talking about a specific type and we have to evaluate it, and like each preemption bill is different, and you need to look at it using this equity lens to decide. Yeah.
So kind of jumping on that and sort of what we talked about a little bit last night, that, when they create these bills, equity is not a goal. So like I'm thinking about like what the outcomes are, like what do we do with this, right? Like we know there's a problem, we know that this is creating inequities, but they might not care that there's poor health, this causes poor health for Black people.
Yeah.
So like why do we think, how do we connect it with cost benefit analysis? Like how do we think about the next step is.
Yeah.
Like, okay, we show this association, but then how do we get to change behavior? They're like, good, that's kind of what we want, you know? Like,
Yeah, the state legislators, they're not my audience. Because I know that our they don't care about equity. You don't go up to the state legislature in Tennessee talking about equity. That's the quickest way to get out the door. But there was a need from people working on the ground that they wanted, because we don't know what the effects are. So even to say, this preemption of this is connected to this, they wanted that information to kind of organize around it. Also, when they're writing even amicus briefs or kind of legal stuff, they need something to cite related to it. And so that's kind of the first step for that. But I think even to do a cost benefit analysis or something, you still need to know what the outcomes are. And so we don't really have that yet. And there has been some work Jennifer Carras-Montes did around minimum wage and connecting that to higher infant mortality rates. And so that might be more compelling because it's babies. It might be, but you can see they're very much thinking in the mind of businesses and employers and their business climate, and just not a consideration about their constituents. It's almost like the corporations are their constituents, the way that they're talking about it and thinking about it. I don't know. We'll see. You had to, yeah.
So one thing I was curious about in the variation of the bills you saw is to what extent do the bills allow municipalities to grandfather in something that was existing? So if the municipality has a higher minimum wage, does the law structure it such that, okay, you already had this minimum wage law, but no more? And that if there's any kind of that might present some variability you could exploit see the impact of those.
Yeah. Sometimes they'll include that they're retroactive in there, sometimes, particularly for the minimum wage stuff and paid leave, but for the project labor, the things related to municipal contracts, they will say moving forward because they're not going to null and void any existing contracts. So if it's about kind of contracts for things, those typically aren't retroactive, but with these other things, they are retroactive. Yeah.
Thank you very much.
Thank you.